My name is Ashley Gibson. I'm a registered nurse and a BSN student, and I want to talk a little bit about Ebola. Ebola virus is an erratic and fatal disease caused by infection with a strain of Ebola virus. Formerly, it was known as Ebola hemorrhagic fever. The disease is most predominant in several different African countries. The first discovery was near the Ebola River in 1976, which is currently considered the Democratic Republic of Congo. Meanwhile, there have been occurrences of Ebola found in humans periodically in Africa. The recent 2014 epidemic in West Africa was the most prevalent and multifaceted in history. By August 2014, there were a total of 810 cases reported, as well as 10 clusters of cases between healthcare workers and facilities that were not considered Ebola treatment units. Two cases of Ebola were introduced in the United States, which resulted in one death. There is a precisely low possibility of an Ebola outbreak in the United States. Countries that have very weak health systems and unavailability of resources are generally most affected. In return, this makes control and spread of the disease very difficult. Ebola is called a filovirus because its structure is composed of long filaments. There are 5 diverse types of Ebola virus that have been recognized and named in representation of where they are derived from in the environment. However, only 3 of this species are notorious for causing symptoms in humans. It can be transferable between animals and humans, which causes further complications with controlling the spread of the disease. In return, the most recent outbreak in West Africa was thought to have originated from fruit bats. This species is also known to infect other animals such as gorillas, chimpanzees, monkeys, and porcupines. Ebola virus can also be spread through the deceased matters of these animals. Consequently, this brings concern for affected areas where these species are ingested as a basis of nutrition. Ebola is spread through mucous membranes and non-intact skin that comes in direct contact with blood or body fluids of an affected individual or animal. Blood and secretions in humans containing the virus are considered contagious. In return, individuals remain infectious even after death. Healthcare providers caring for infectious individuals are at the greatest threat of acquiring the virus because they are in close proximity with infected blood or body secretions. Ebola can survive outside the human body as well. As a result, it can be transmitted from direct contact with contaminated items and materials or medical equipment. Infected wildlife is also contagious. Therefore, individuals can acquire Ebola if there has been any interaction with the infected wildlife. For example, in Africa, Ebola may be transmitted accordingly from handling bushmeat or coming into direct contact with the bats that are infectious. Transmission can also occur from having sex or intercourse and coming in contact with semen of a man who is a survivor of Ebola. It is not identified if Ebola can be transmitted by vaginal fluids from a woman who has had the disease. An individual who is already exhibiting symptoms is considered contagious and can transmit the virus to others. Ebola is not transmitted through air, water, or food. The diagnosis of Ebola can be very difficult, particularly if the individual has only been infected for a short period of time. This is because individuals with other illnesses present with similar symptoms of Ebola in the early stages of the disease. Public health authorities should be notified and the person should be isolated if they have been in contact with an infected individual or contact with contaminated objects of an infected individual, infected fruit bats, or a man's semen who has survived Ebola. Several different types of laboratory tests can be used to give a definite diagnosis. Only after the onset of symptoms can Ebola be identified in the blood. A fever is usually the first symptom an infected person presents with. This accompanies the upsurge of moving the disease throughout the individual's body. Once the onset of symptoms has occurred, 3 days may pass before the virus reaches measurable levels. The body's vascular system becomes impaired. As a result, numerous organs eventually become destroyed. One study has found that the disease causes an altered immune system response in the initial stages by hindering the actions of interferons, which is the body's primary defense against viruses. It takes approximately 2 to 21 days from the time of exposure of the infectious agent until signs and symptoms of the disease appear. Symptoms generally include fever, weakness, muscle pain, headache, and sore throat. A flat reddened rash with papules can occur by approximately day 5. Vomiting and diarrhea are an innervating part of the disease process. Internal and external bleeding can occur due to compromised liver and kidney function. Ebola has an extremely high fatality rate, and length of survival is unknown as it can vary from hours up to 2 weeks. Many factors must be taken into consideration when reflecting on a communicable disease such as Ebola. Epidemiologic theories are used to comprehend and describe by what means disease transpires as they do in humans. Healthcare professionals use the latest medical technology and practices to help guide healthcare, which is beneficial in improving patient outcomes. Certain interventions can be used to prevent, cease, or reverse a communicable disease, such as Ebola. Health teaching and counseling are significant aspects to help prevent the transmission of the disease. Nurses should provide education to the public about various ways by which the virus can be spread and contained. Personal and environmental precautions such as checking food, washing fruits, and being aware of contaminating drinks is essential. Specific protective measures are aimed at preventing development of the disease. It's important for healthcare workers to take particular safety measures, such as correct use of protective equipment, to ensure adequate protection to help prevent exposure. Personal protective equipment should include gloves and a long-sleeve gown. The use of face protection, such as a medical mask and goggles, are necessary when in close contact with infected patients. Healthcare providers must know the proper steps for applying and removing PPE. Even one mistake in applying and removing PPE can result in the transmission of the virus. Furthermore, laboratory workers are at increased risk for exposure. It is important for skilled staff to properly handle specimens taken from humans and animals to help reduce threat to exposure of the disease. Specimens should be managed in suitably prepared laboratories. Early detection and prompt treatment as early as possible will help slow its progression and inhibit further complications. Nursing activities such as education are essential to prevent further deterioration of the individual's condition. Referrals to other resources may be necessary to aid in minimizing the individual's loss of function. The emergence of new diseases such as Ebola has required healthcare professionals to be more alert, and meticulous monitoring of public health has taken effect. Communicable disease control consists of regulating environmental elements and individual behaviors that enable the transmission of the disease. Communal sanitation methods have the biggest impact on governing communicable diseases. Constant recognition and proper triage of Ebola cases is crucial in achieving decreased spread of the disease. Overcrowding, adequate space, adequate supply, and lack of training in the use of PPE and observation to safeguard constant devotion to infection control methods need to be observed. Healthcare workers are especially susceptible to exposure. A variety of opportunities exist for transmission, such as exposure to individuals with undetected Ebola, inadequate use of PPE, and insufficient cleaning and disinfecting of environmental surfaces. Reinforcement of infection control measures is the focal prevention recommendation. There is no existing vaccine or cure for Ebola virus. However, there are two prospective options for vaccines that are being investigated. Healthcare providers aim at management of symptoms. Vigilant waiting, along with maintaining fluid and electrolyte balance to prevent dehydration and oxygen therapy, are necessary. Antibiotics may be administered to halt secondary infections. It is important to manage complications as they arise. Care is merely palliative and supportive in nature. Isolation is also required to prevent the spread. Blood from survivors is thought to be beneficial by providing passive immunity. On the other hand, this poses other risks for developing hepatitis B or HIV. It has been identified that the spread of Ebola can be reduced and ultimately stopped. It is important to place infected individuals in Ebola treatment units or community care centers where the possibility of transmission can be decreased. These locations inspired deviations in human behaviors to decrease the possibility of exposure, such as assembling harmless burials. Patients who receive care in such locations helped reduce transmission by preventing the likelihood of 4,487 cases. In return, devising that patients be treated in such locations is an important aspect for an effective public health response to the outbreak of Ebola. Public awareness is an important component in reducing transmission of the disease. The involvement of the community is a substantial feature in successfully regulating an outbreak. Outbreak prevention is dependent on appropriately applying a combination of interventions. These interventions should include an interdisciplinary approach, observation and security, an efficient laboratory service, safe burials, and communal utilization. Decontamination and adherence to infection control practices cannot be overemphasized. Ebola must be detected early in the disease course so that it can be quickly isolated. Therefore, infected individuals do not remain in the community, likely spreading the disease to others. Prevention is better than cure, and health care for infected individuals is palliative as survival rates are very low and Ebola virus disease is highly fatal.